welcome to the PDX Tug. We're so happy to have you here, and we have a great show planned for you today. So let's get into it here. Of course, today is the 15th of December. Hopefully you're all ready for the holidays. We sure are. We've got a nice situation planned out for you today. So let's talk a little bit about some housekeeping about the PDX Tug. We do this monthly, once a month, the first Thursday at 1 p.m. Pacific time. So as you look at us, we have the leadership team here. We have Ryan Callahan, who you want to introduce yourself, carry on.
Sorry, I have to find the unmute button. Ryan Callahan, been one of the tug leaders for 2 or 3 years now. Happy to be here.
Great. Then we have Cynthia Maywalt.
Also finding the mute button. Hello, everybody. Nice to see everybody, or see everybody.
Cool. Danny Steinmetz.
I was hovering on that mute button. I was ready to go.
You were ready for us? Good.
Yeah. And then Jack unfortunately couldn't make it today. So
Right.
I'll introduce for both of us.
Cool. And then again, my name is Chris Williams. So as far as the upcoming tugs, we have one at the very first week of January 5th, and also at 1 p.m., of course, following the first Thursday theme, February 2nd, 2023, and then also March 2nd, 2023. So feel free to bookmark your dates, put them in your calendar so that you don't miss anything that happens here. So when we take a look at the PDX Tug, one of the first ways that you can figure out what's happening with the tug is to come to the usergroups.tableau.com and then look for the PDX Tableau user group. So when you do that, you'll go to the page and they'll ask you for everything that's happening here. And so when you look at this page and you maximize the screen here, and I'll go right over here, it'll take you to this lovely screen. So what you want to do is click on this subscribe for updates button. That way you know when everything that's happening with this wonderful user group. Additionally, if you are curious and wondering, hey, how can I be a tug presenter? What you want to do here is click on this presenter sign up button and then go ahead and tell us what you want and what you want to do. And we'd be more than happy to find a way and find a time for you to present to us, because we always want to have more people, more interaction, more people going ahead and talking about what they're doing so well. So we get back to this screen here in the tab, the community page. So clicking over to the community page over here shows you a little bit about the Portland user group. You'll see some of the video gallery here, which is important because I'm going to give you that YouTube link here in a minute. And then it shows a little bit about what's going on from the Tableau perspective. So we have the group leaders, the descriptions, you can see all the blogs over here. And, you know, if you have questions, one of the things that I would love for this group to do is to start posting them here. Let's have more of an online conversation and show everything that, you know, the strength of what this user group actually is. 2, this is the Tableau user group channel for Portland. If you do a search on Portland, you'll be able to find everything just like so, because you can see the query here for Portland. You'll see all of the saved user groups presentations. All of them are right here. Feel free to read them and watch them as you will. You can find any of the ones that you're going to see that in the existence of this lovely group, as well as the one that we're going to have right now. That'll all be posted here eventually. Okay, let me get back to the presentation here. So today we're actually going to forego the community spotlight and go right to our main event. And we are so honored to have Shannon Allain from Oregon Health Authority here to do some wonderful presentations on her Tableau work with the pandemic and COVID-19 pandemic. Shannon has served on Oregon Health Authority's initial COVID-19 response in leadership and project manager roles as planning section chief and deputy incident commander. In the spring of 2020, she moved to the data team to help launch case investigation and contact tracing systems and support new Tableau reporting. She has enjoyed leading a team in creating and maintaining and refining suites of COVID-19 dashboard reports, which is the whole reason why we're here. So without further ado, what I'd like to do is give Shannon the floor and the stage and allow her to go ahead and show us and talk to us about what she's done. So please, when we're talking about Shannon's, one of the things I wanted to mention before Shannon got started is that as she goes through her presentation, please feel free to accumulate your questions, and then we'll go ahead and share them with her at the end of her presentation, and she'll be able to answer each and every one of them. So now I'll give Shannon the floor.
Thank you so much, Chris. Let me go ahead and pull up my slides. All right, as Chris mentioned, I'm Shannon Allain, lead data visualization informaticist with Oregon Health Authority's COVID-19 Response and Recovery Unit. And I'm very excited to be here today to talk to you about visualizing the curve, Tableau development during the COVID-19 pandemic. By the curve, I mean Oregon's COVID-19 epidemiologic curve, or EPI curve, which shows the number of cases by date of symptom onset. The EPI curve is an essential tool in assessing disease progression in a population. Likewise, this Tableau dashboard, the first dashboard OHA published with COVID-19 data, marked the beginning of a whole new body of work for our team with its own peaks and valleys. OHA has used Tableau during our COVID-19 response to keep people informed as to the spread of COVID-19 in our communities, both for policy and personal decisions. This timeline shows the number of new OHA COVID-19 Tableau workbooks by month of initial publication, with circles scaled to represent between 1 and 7 workbooks. After initial releases in 2020 and 2021, our Tableau development has transitioned to mostly dashboard refinement in 2022. This includes condensing our reporting for clarity, building more sustainable processes, and sharpening our messages to help cut through COVID fatigue. It's very exciting to see this level of public engagement in public health data. Our team has published 41 public-facing Tableau workbooks, which have received over 21 million views. We're so glad people have found these data useful. For today's discussion, I'd like to highlight a few areas of focus for our team's Tableau development. First, how we've worked to improve data quality for near real-time reporting. In public health emergency response, timeliness is prioritized. We can't wait for finalized data sets as with other reports. Next, how we've adapted. As we learned more about this emerging disease and evolving situation, the reports have had to change accordingly. Next, some considerations on design requirements, taking into account equity, accessibility, and business continuity. And finally, we'll close with an example of a dashboard revision that centralized reporting across data sources to make it easier for users to see trends at a glance while leveraging the workbook to create multiple products. Let's start at the beginning with the data. For a fuller picture of the COVID-19 situation in Oregon, we bring together many data sources. This is a high-level overview of the data sources my team pulls in to assess COVID-19 vaccination, testing, cases, SARS-CoV-2 variants, and health system burden in Oregon. We use a variety of tools to pull data from transactional information systems to reporting data marts, and to prepare data sets for dashboard development in Tableau Desktop. Much of this is made possible by the vision and commitment of OHA's Communicable Disease Informatics team and our IT partners. They've been incredible. I won't be delving into the details of our data streams here, but I'm happy to take questions. Most of the data quality assurance and improvement efforts take place upstream of our Tableau development through data validation in our transactional databases, message specifications for our data senders, and record review by staff. But these data can be messy and sometimes issues slip through. Our team utilizes scheduled data source extract refreshes and runs of published Tableau prep flows on our internal Tableau server. Scheduling Tableau prep flow runs on server is made possible by Tableau Prep Conductor, which is part of the Tableau data management add-on. The server scheduled extracts and flow outputs power the internal data quality and situational awareness dashboards developed by my colleague Stephen Barry, so we can monitor the situation and check for data issues and address them. Having these on Tableau server has been so helpful in keeping our team on the same page and able to quickly identify and address issues, both with individual data points and whole data streams. The only constant in the COVID-19 pandemic has been change. 2 examples for our team include where data visualizations are published and what data we visualize. After an initial proliferation of reports, related information was presented across multiple workbooks. If the way we organize data made sense to the user, great. But what if it didn't? One of our developers, Madeline Lavasser, proposed providing an alternate means of data viz navigation through a table of contents workbook, which is now featured on our Tableau public profile, so it's always listed first. It's organized by area of focus, statewide data, regional data, or health equity data, and by content type. On the first 2 tabs, looking by geographic granularity, statewide versus regional or county data, users can browse data on COVID-19 vaccination, testing, sequencing, hospital capacity, and emergency department visits. On the 3rd tab, which highlights health equity data, users can browse data by race and ethnicity, age group, language, and disability. The structure has been proven to be very effective. Previously, users had to be familiar with the dashboard reports we produce and how they're structured, what they contain. Now, all users need is interest or a question, and they can browse the types of information we provide to find what they're looking for, or maybe even see something related that they didn't realize was available. It's also been a place where we can feature new or frequently referenced visualizations or indicate archival status as reporting needs change. We've needed to refine metrics as we learned more. Our team had to adapt. Some of the changes have included moving from a person-based to test-based measure of percent positivity as testing availability and practices shifted for a more complete measure of testing and disease spread in Oregon. We've also refined the syndromic surveillance COVID-19-like illness query to include medical coding that didn't even exist before the COVID-19 pandemic. We've also developed metrics and shifted them from required to informational to align with changes in policy. This has applied to our public health indicators dashboard, county risk metrics dashboard, community spread metrics dashboard, and levels of community transmission dashboard. To maintain transparency and to be able to quickly bring back a report if needed, we opted to archive dashboards with show hide container splash screens. I saw this splash screen tip at Tableau Conference 2019 during the Container Your Excitement Dashboard Tips presentation, and I think it's a great use case. Workbooks that aren't updated are naturally pushed to the bottom of a Tableau public profile. To tidy things up further, in 2023, we'll be removing archived reports from what's publicly listed on our Tableau public profile page. But those archived reports will still be available by direct link and easily retrievable upon request. Due to the urgency of the situation, we didn't always have or make time for robust requirement definition at the outset. As our reporting team matured, we focused on 3 key areas: equity, accessibility, and business continuity of our dashboard requirements to ensure we were designing for all. We want our data visualizations to reflect our core values. OHA has adopted health equity as one of its core values and is committed to its strategic goal of eliminating health inequities by the year 2030. Our team believes that accurate representation of the health inequities faced by our diverse population is central to this work of community-driven health equity. Rate ratios are an example of where we've used a metric to highlight health inequities. On the Oregon Health Authority's COVID-19 pediatric report dashboard, I compare case rates by ethnicity to measure the health inequities experienced by youth aged 0 to 17 years who identify as Hispanic. Dividing the weekly Hispanic case rate by the non-Hispanic case rate gives us the rate ratio. A rate ratio of 1 means the case rate is equal. A rate ratio of greater than 1 indicates a health inequity in the Hispanic population. A rate ratio of less than 1 indicates a lower case rate in the Hispanic population compared to the non-Hispanic population. You can see that early in the pandemic, youth who identify as Hispanic were disproportionately affected with rate ratios well above 1. Rates became similar with the rate ratio approaching 1 in mid-2021. Showing data that measures health inequities can help direct resources, spur outreach, and motivate partnerships to address and eliminate the inequity moving forward. We also wanted our dashboard reports to be usable by all people to the greatest extent possible. Universal design is simply good design. OHA's accessibility team brought it to our attention that our Tableau dashboards were not as accessible to people with disabilities or access needs. Together, we dug into the Web Content Accessibility Guidelines, or WCAG, to see how we can apply these standards for accessible digital content to our Tableau dashboards. This is a great place to start if you're also looking to assess and improve the accessibility of your dashboards. Kelly Gupton is the accessibility subject matter expert at Tableau, and she maintains an accessibility frequently asked questions document on the community forum and has an on-demand webinar on applying WCAG to data visualizations. I recommend both. Tableau took a big step forward in supporting accessible dashboard design with the 2021.3 release, which applied default top to bottom, left to right focus order. This was huge. The approach previously was unpackaging workbooks and directly editing the XML. It was very cumbersome, and our early attempts resulted in some workbook instability, so we were very excited for this feature. After many working sessions and lots of trial and error, learning how to work with or around Tableau, we settled on a plan for how we could apply WCAG in concrete actionable steps in Tableau development. In partnership with Deloitte, we expanded our documentation into a step-by-step guide that both new and experienced Tableau developers can follow. This process has fundamentally shifted how our team approaches new development, and we've made progress on remediating existing dashboards. I hope this guidance document will help you with the same. Some of the tools we use in our accessible design and remediation include the WebAIM contrast checker to ensure we meet minimum contrast ratios for text and visualizations. We're also working to incorporate the WCAG guidance 1.4.1 that color is not used as the only visual means of conveying information. When using color, we like to use direct labeling or shapes as well. If you're looking for a contrast ratio-based color palette generator, Leonardo is a great option. For assessing usability and focus order, we use screen readers like NVDA and Windows Narrator. Another great tool is Firefox's Accessibility Inspector. Simply press F12 to bring up the inspector on a published dashboard. And from the Accessibility tab, select Show Tabbing Order. It's a really nice way to see at a glance which dashboard elements are focusable and in what order, both for keyboard navigation and screen reader consumption. We also wanted to ensure that these important data were available to the people who need them when they need them. Both our external Tableau server and Tableau Public can host dashboards for public consumption. Publishing to both servers allows for more resilient business practices. Our team elected to separate the primary dashboards, which are published to Tableau Public, from their complementary summary table workbooks that allow users to download the underlying data, often published to our external Tableau server. In this structure, if Tableau Public is down, the summary tables can likely still be published. And if our external Tableau server is down, the dashboards can likely still be published. The structure also allows us to use Tableau server's customized data download options. On Tableau Public, you can't grant data download access without allowing download of the workbook. The external Tableau server allows for more granular permission settings. Guest users can be granted view, filter, and download rights for images and summary data, and the download rights for the workbook can be restricted. These settings help mitigate the risk of an external user downloading a copy of a dashboard report and republishing it, misrepresenting the agency. These settings also provide the data transparency we need to support external analyses and the data access we need for accessibility. Finally, let's look at an example of a centralized dashboard report with multiple uses. From the OHA COVID-19 responses situation status report came the first iteration of Oregon COVID-19 update Tableau dashboard, seen here on the left. It fit a lot of tabular information into a compact space and was effective at automating this recurring report. But it wasn't taking full advantage of the visualization capabilities of Tableau. The next iteration, seen here on the right, had a lot of bands, also known as key performance indicators or KPIs. Some trend indicator arrows are present, first 1 and then 2 time series, in addition to some tabular data. We're making progress. This is definitely more visual. There's a time series for new cases in the bar chart that provides some context for the new cases bands. The hospital capacity band has an arrow indicator, but you can't tell how much the value has increased or for how long. The testing and death bands don't provide users with the benefit of any additional context. And the bands all kind of run together and are given equal weight. We learned a lot, but it was time for another refresh. With the most recent iteration, I wanted to provide a high-level situational overview with several of the data sources we use to monitor COVID-19 in Oregon. New cases, deaths with COVID-19, health system burden, testing, emerging variants, and vaccination coverage. I kept the blue theme that we had distinguished this report from so many of our others to preserve user recognition. This is a condensed version of the dashboard to give an overview. I'll expand some portions of the dashboard to highlight a few features. On Tableau Public, each section is given the full width of the dashboard for greater visibility. A filter allows users to switch from the statewide view to data for the county of their choice for most but not all data elements, so the header specifies the geography shown. In this version, I grouped closely related data together. I wanted to clarify the message by keeping to just a few bands for each data source and pairing each set of bands with a time series to provide that important context. In this view, cases and deaths are grouped together under a cases header. Both show the number newly identified and over what time period, as well as the cumulative total. Both cite the data source that provide these data and are paired with a 6-week time series. I added links on the right to connect users to related dashboards for more information and conducted a first round of accessibility remediations, making use of sheet titles and captions, as well as dynamic text for screen reader consumption. While consistency is good, you can't superimpose an approach that doesn't make sense with the data. The hospital capacity data presents a daily census of hospital beds. Patients are counted each day they occupy a hospital bed in Oregon, and it wouldn't make sense to present these data as a weekly or cumulative total. So the most recent count is shown from the day of report. I used direct labeling along with color to represent the number of COVID-19 positive patients hospitalized versus those in intensive care unit beds. And a dark border between the shaded portions of the area chart provides the color contrast needed to distinguish between these categories. Direct labeling and most recent value bands are also used for the vaccination portion of this dashboard. with a link to the vaccine effort metrics dashboard by my colleagues Paige Snow and Alex Shee that's just packed with info. And when one viz doesn't tell the story, try two. COVID-19% test positivity is calculated by the number of positive tests divided by the number of total tests. On the COVID-19 testing portion of this dashboard, I included time series for both the number of total tests, the bar chart, and the percent positivity by day, the line chart. As the number of tests per day can vary by quite a bit, which in turn affects the test positivity calculation. With each step, I tried to keep the user in mind. What's important to know? What would make interpretation easier? These are the questions that drive our development. Rolled into this workbook revision were 2 additional products to streamline our reporting processes. Now the same workbook with the main dashboard with a thumbnail shown here from Tableau Public. Also has a condensed layout from which I generate an image that our fabulous social media coordinator shares on OHA's Facebook and Twitter, and our web team archives to our report website. The workbook also has a layout that's embedded on OHA's COVID-19 website. So now when I republish the dashboard with refreshed data every week, the top line numbers are also updated for our communications and web teams. Automating this step and synchronizing the information release time has been a big improvement. There were definitely growing pains. Change is hard, but with a conviction that the change is truly an improvement, lots of communication, and the support of an amazing team, you can weather just about anything. With that, I'll close with an invitation to connect and check out our dashboards. My email is here. Please don't hesitate to reach out. And I've included links to our COVID-19 Tableau public profile, table of contents, and Oregon COVID-19 update dashboards, as well as the associated summary table. I'm happy to take your questions.
Hi, Shannon. Yeah, that was wonderful, and this is super. I'm really, excited to hear all these. One question that we had in chat was, could you touch on any issues that you may have had with racial data? Sometimes you get some inconsistency with what information is collected and reported, and people were wondering how that was handled.
Yeah, great question. It's definitely an evolving approach as how we want to identify the categories. We want that to more accurately reflect how people identify as themselves. So early in the response, and you'll still see that reflected in many of our dashboards, are these kind of broader categories that don't always reflect how people identify. They're taken from federal standards. You'll hear OMB tossed around. And those are fairly broad boxes. And we're still working through how to more accurately reflect people's identities in the data. We have a standard that you may have heard in Oregon called REAL-D, race, ethnicity, language, and disability, which has a much more rich data in how people identify in racial and ethnic groups that can be disaggregated. So we're working with the Office of Equity and Inclusion to firm up our approach on how to best represent those data so we can report them publicly. But yeah, it's definitely a rich and important area that we're still exploring on how to highlight those health inequities. As has been really apparent throughout the COVID-19 pandemic, you do see
maybe experience some technical difficulties here.
some differences between case data, those richer for some of our data sources, like but not for vaccination data and not for emergency department visits. So it's really pretty varied, and trying to get all your data sources to talk to each other and comparing like with like can be a real challenge.
Yeah, for sure. And that's a question that's kind of hard to answer, and you did a really good job trying to sort through the layers of how to get some of that data and try to classify it. We did have another question. We have a couple other questions in chat, one from David. Can you talk more about the web embed process for OHA and who owns which part, please?
Yeah, happy to. Let me see if I can just pull up that recent or that workbook.
Either Shannon has frozen in time.
So this is that Oregon COVID-19 generates that main dashboard that you may be familiar with. Other tabs for that county table that has been very popular among our social media followers, as well as the image that I mentioned that's shared on social media. And connected to all these same data sources is kind of a hidden layout that is that web embed. So the same data sources that drive these new and cumulative total cases, as well as new and cumulative total COVID-19 associated deaths, and that hospitalization current census. Once they're updated on the dashboard, they're also updated on this web embed layout. And with some troubleshooting with our webmasters, figured out how to get this layout to kind of mimic the web tables that they had been producing previously, and find a layout that reflected, or that was responsive enough to fit the frames that are within that website. So if I go to this same workbook and just change the end of that URL, or sorry. Having some loading issues. But once that web embed is loaded, you can go to that published page on your Tableau workbook and grab from the share button, grab the embed code and provide that to your webmasters, and they can embed that visualization on your website. And that's been a really slick connection for us to help improve that communication between us, the data team, and our communications partners from external relations.
Cool. Okay. We have several more questions, if you don't mind.
Yeah, of course.
We have one from Kevin, who asked, how much experience did OHA have using Tableau prior to COVID, and what steps did you take quickly to develop those skills needed to be effective? Yeah,
great question. OHA is a big organization, and there are many programs within OHA, each with kind of in their own place with Tableau development. There are some programs that have been before COVID-19, more on that leading edge with the OHA on Tableau use. Health Policy and Analytics Division within OHA does a lot of nice work with Tableau. Within the Public Health Division where I work, the Injury and Violence Prevention Program did some early work with Tableau as well. But it was kind of hit and miss. Not all programs had adopted Tableau, but pre-COVID, there was a push within our public health division's director's office to prioritize certain data sets to make them more visually accessible to the public. And the acute and communicable disease prevention section, where I came from before COVID, we were part of this Tableau discovery workshop, and we consulted with some groups and got our training up and running. And this was January 2020. So during our Tableau discovery workshop, we had a lot of key folks dipping out of the workshop to go down the hall to the incident management team and address this emerging situation. It was really unfortunate timing. So it kind of stalled a lot of the efforts that were ramping up in other programs within the public health division as we redirected a lot of resources to the COVID-19 response. So for COVID-19 and Tableau, that started ramping up in spring 2020, pretty quickly identified that as this was expanding and
Right.
not going away, that we need to set up some pretty robust mechanisms for ongoing reporting. So in partnership with our IT department and our informatics teams, developed mechanisms to get the data out of our transactional systems into reporting data marts in SQL, and then connect to Tableau dashboards. So we leaned on our health policy and analytics colleagues who had a little bit more experience in Tableau to kind of consult on that first EpiCurve dashboard that was developed by our IT partners and some of our staff from the Council of State and Territorial Epidemiologist Fellows. And that we haven't looked back. So
Right.
we've kind of taken off since then. I joined the team later that spring, and then we were able to hire on a team of several folks, some with Tableau experience, some without, and kind of do on-the-job training to get everyone up and running and developing.
Right. Good deal. 3 more questions. And one from an attendee does OHA have the total hospital bed capacity available for the comparison to number of occupied beds? This person remembered at times viewing the number of occupied beds increasing, but without knowing the overall capacity, it was hard to know how close they were to total capacity. Do you have any thoughts on that particular topic?
Yeah, what a great question. I've had that question for our HOSCAP, hospital capacity team as well. And it's really hard to pin down. This is my personal take on it. It seems like it's a hard number to pin down because hospital capacity is so dependent on staffing, hospital staffing. It's not just how many beds does a hospital have, it's how many staffed beds a hospital has. And that's really changeable, depending on, especially as you get staff burnout and turnover, but also like if staff are exposed and need to be excluded or get sick. And hospitals run at pretty high capacity just normally. That's how they function. And so it's been challenging to communicate that point. But I'm looking forward to seeing more from that hospital capacity team moving forward. I think they're working on additional reports.
Good deal. Was there ongoing collaboration with other public health authorities? And if so, what did that look like?
Yeah. So in Oregon, there are local public health authorities and tribal health authorities within our state. So at the county level, there are our partners that do the on the ground work of case investigation within our communities. Many of those local public health authorities have their own Tableau dashboards that you can check out. So of course, there's regular contact and discussion between the state and local public health authorities to make sure that we at the state can support the work on the ground that our locals are doing. But as far as like Tableau collaboration, there has been less of that up to this point. We try to make sure that we're meeting the needs of our local users, both as contributors to our surveillance systems, but also the people who need this information to provide to their local leadership and to do their own work. So certainly welcomed their feedback and incorporated it when we could, but it was these dashboards were largely a state-driven effort.
Sweet. And then Emerson had a question. He's noticed that some OHA pages use Power BI instead of Tableau. Do you know how, or are familiar with how one might be chosen over the other? What evaluation process might have gone through?
Yeah, it's an interesting question. To my knowledge, it's kind of dependent on the program and their comfort, like their staff comfort level or training for that tool, BI versus Tableau, and licensing costs are all considerations. But yeah, it is interesting that the state supports visualization via we have ArcGIS visualizations, we have Tableau visualizations, Power
Right.
BI. It's pretty varied. There's some are shiny out there. It's not like a unified approach. It's pretty adaptable to the staff and program needs.
Sweet. Okay. I'm going to open it up to anybody else, the panelists. Do any of you have any additional questions for Shannon? Please feel free to take the floor.
I have a question, Shannon. But first, a statement. I'm very excited you're here because I've wanted to have you here for basically since I first saw the dashboards, and so now it's almost 2023 and finally got you here. So welcome.
Thank you.
But I remember, I don't know, maybe spring of 2020, first discovering the COVID dashboards on the OHA Tableau public site. One, I was like, I was really impressed that I was like, wow, they really rolled out these dashboards quickly and they're useful and they look pretty good. Like, I was impressed. Not that I had any doubt. But they just looked pretty, it was, very useful. And then, also had the thought at the same time, I was like, these are Tableau dashboards and they're probably the most looked at Tableau dashboards in the region. Like, I don't know, is there anything else that was more visible during that time? And so that made me think, Tableau public to a lot of us is this place where individual developers like post things that they made that are cool looking, and that's often how we've uncovered Tableau public. But Tableau public is this useful tool for it's like serious public outreach. You touched on this a little bit. You had you talked about making sure that in some cases, like, you can't download the data, or you're very careful with like the creation of the thumbnails that when they get shared, those are things that I just don't think about because I'm not doing things in Tableau public on the scale that you are. And sorry, long-winded context to the question of simply how what are the things you have to think about when sharing data publicly like this? What are the things that you wish Tableau public maybe could do that maybe if you were just doing this internally, privately, Tableau servers or Tableau cloud that has? I'm just curious, like, what are the limitations there? What are the strengths of it?
Yeah, great questions. As far as like strengths, I think discoverability is really great on Tableau public. To be able to search, it'll pop up in a search engine. All of that is like really great for visibility. And it has like pretty logical URL construction, which is really nice to have that as well. And it's really robust, able to withstand like spikes in traffic that kind of more like smaller, more locally supported Tableau servers might not be able to respond to. As far as like downsides, I really wish that it had more granular permissioning. It's pretty blunt. It's not totally black and white, but it's like a little bit all or nothing. And I wish that there was a little bit more control there to be able to provide a fuller experience on Tableau Public, especially since exposing the underlying data, which is only available with that allow access toggle, is really essential for accessibility. Those visualizations, having that view data window pop up is how a screen reader can consume a chart that sighted users like me can just see. And so like having to like separate that experience is a little unfortunate. As far as like considerations for an agency like us in using Tableau Public, we're really careful about construction of our data sets. This is protected health information, so all of the de-identification and aggregation and small number suppression happens way upstream before we even connect to Tableau Desktop, so that when we connect to Tableau Public, we're not worried about exposing something that we shouldn't be exposing. That's the number one consideration for me.
Okay. I don't see any additional questions in the chat. I trust the panelists. You guys and gals, do you have any other questions? Are you good to go? Okay. Well, Shannon, I want to reiterate again how wonderful this presentation was. Absolutely. Give me my round of applause. Thank you so much for your time. I understand how busy you are. This was phenomenal, and we're honored to have you here. Thank you so much for sharing your expertise with us today.
Thank you so much for having me. Yeah, and we'll be continuing Tableau development with the Public Health Division moving forward. So please don't hesitate to reach out if you see something you're curious about. You know where to find me.
Absolutely. And also keep in mind, Shannon shared her information in the presentation. We will be having a recording posted up on those sites that I mentioned to you earlier. And without any further ado, if nobody else has any questions, I'm going to say happy holidays to everybody. Everybody have a very safe holiday season. And we will see you same bat time, same bat place, January 5th, 2023. Okay. Thanks again, everybody. Have a wonderful afternoon.
All right,
Thank
thank
you.
you, everyone.